Okay, so welcome to this evening's webinar. Thanks for coming along. And I'm aware that many are quite zoomed out over the recent events and now busy getting back face to face, which makes this quite an interesting topic in terms of bringing people back and getting people moving again and fit for purpose, shall we say. Yeah, I mean, the title really, what the hell is functional training, I guess, was a little bit of a deliberate enticement, but at the same time, I guess in literal terms, really, what is it? So the point of this webinar really is to dissect some language, to run through definitions, look at the evidence, and explore a little bit around what we think of as functional training, what the purpose of it is, whether it's still fit for purpose, or whether it's actually out of date now. And so we're going to challenge things, we're going to look at the evidence as well, and the idea being to then be able to go away, do further reading, further research. This is just obviously a short snippet in this webinar. But what I wanted to do is actually, I'm going to start it with my video, if that's all right with you guys. And I'm aware that Sharon will have seen this, but for others, possibly not. And I'd just like to run through something that I think we all know and understand a little bit about, but just to set the tone for then going through the workshop. So, but as you drop in, if you just let me know your professional background, that can help me as we go through it, and I'll introduce myself fully in a moment. But I'm just going to introduce you to my friend over here, and the concept that the body is an integrated system, which is ultimately why we think about training it functionally, because it works as a series of chains, kinetic chains. So just to run through an example of the way the body works, what can happen when a part of the body doesn't work, and how that can affect the whole system, if you like, so to speak. So our clients' bodies are made up of three subsystems: the myofascial, the skeletal, and the neural. We've got different body parts: pelvis, spine, shoulder, knees, feet, if you like, as a way to differentiate them. And each part contributes to gross movement or active daily living and lifestyle. If we take the pelvis, first of all, for example, and it should tip both anteriorly and posteriorly, and then when we walk or run, it should rotate on either side. It does that from the center of the pelvis, if you like, at the sacrum, where the sacrum meets the ilium. And effectively what's happening when we walk, as the leg steps forwards, this side of the pelvis will rotate up and back so that the foot clears the floor. And then as we step down and back, the pelvis rotates forwards and down so that we can push and propel ourselves forwards. The pelvis on the opposite side, or the ilium and the sacrum on the opposite side, that sort of SI joint, will do the opposite. So effectively getting a lengthening and shortening of the legs. Biomechanically, that should happen. What can result from our lifestyle today are compensations around the muscles of the pelvis, piriformis, the glutes, very commonly spoken about. They have close relationships with areas like the sciatic nerve. And if these muscles that cross this sacroiliac joint adapt enough or for a long period of time, they can influence that movement's quality, if you like. So what that could leave us with when we get up, maybe from 9 hours sitting at a desk, is if the hip muscles have adapted enough, we could be left with a functionally long leg. If we have a functionally long leg in our clients and we don't identify that, what can happen is the long leg can buckle in to allow for the fact that the pelvis isn't moving as freely. And if they walk or run for any length of time on that knee valgus, they might complain of knee pain. They might complain of shin pain or even foot pain. when actually the problem is coming from an adaptation of the pelvis. We could take the compensation in the other direction, and instead of the knee buckling in, there could be an elevated ilium on one side, and that can then create a functional scoliosis. This can obviously result potentially in aches and pains through the back, the shoulders, and a multitude of other areas of the body. So the point I'm making is the body works as a system. It does that really well, but it also means that it's tricky when we as movement professionals and therapists are trying to identify what's going on and understand the right exercise program for our clients. So I hope that makes sense, just as an initial caveat, because I'm going to work from a PowerPoint now, if that's all right with you guys. We've got something to refer to, and just bring that up. Let me just move that across. Okay. So coming back to the point of the webinar, what the hell is functional training anyway? And I really like this image, actually. It brings forth a multitude of thoughts. I'm going to ask you to do a couple of things as we go. I don't need to see them, just for your own thoughts afterwards. So if you've got a pen and a paper, make sure you've got a drink or something. We're going to go for about an hour, maybe a little bit longer, because I can kind of go into sort of more explanations. It can sometimes take a little longer. We'll certainly have time for a little bit of a Q&A at the end of the session. So why do this webinar? Well, one of the things that we do in biomechanics education is we try to encourage our industry, all of the learners that come to us, or any of the people that we are in front of, to challenge everything. We, of all the body workers, are potentially the least educated in some aspects of our training. Even if we've been in the industry, like I know Sharon and I, we've been around for several decades. And so even though we've gathered lots of education, we've spent a lot of money, potentially there are some gaps. We're not regulated in the way other body workers are, like surgeons or occupational therapists or physiotherapists, for example. We're kind of the non-academics, if you like, if I was to blanket term our industry. Ultimately, we're passionate about helping people move better. And so to understand the body, the science, how that all comes together, and then how we can hopefully solve some of our clients' problems better using critical thinking is a key aspect of what I'm trying to highlight, looking to highlight through this webinar. This slide is purely because it makes me chuckle. So, as Tony Robbins would say, getting into a state helps the learning process. So I hope you enjoy that one as well. But my background ultimately is 3 decades, originally as a professional dancer, and then coming into the fitness industry along the same time that I was working in the care industry. So I was gathering a variety of skills, Group X, counselling, teaching. I was working in care with elderly and disabled, but ultimately ended up in the health and fitness industry, gaining a real special interest in biomechanics. Biomechanics of movement, from the simple aspect of just understanding why people move the way they do. I've gone on and gained skills in soft tissue therapy and strength and conditioning, but fundamentally I enjoy being in an education environment, and I'm forever learning from you guys. So please do feel free to ask questions. I will come to them at the end, or you can certainly ask afterwards as well. So the objectives of this webinar are to ultimately define what is functional training. I'm going to ask you to do that yourselves, is think about in your mind, what do you feel is your definition of functional training? We're going to look at some of the leaders in those areas, or who are specialised in functional training, who have written books or they're well known in the industry or around the world. What we're also going to do is try and look at both the strengths and the weaknesses of functional training and explore new ways that we might be able to better prepare our clients, reducing their risk of injury, but at the same time, optimizing their performance. So I want you to think about why you're here. I'm intrigued why you're here, and what motivated you based on the information we put out in the advert. Are you a rule breaker? Do you challenge concepts? Do you use functional training or promote the fact that you are a functional trainer? Maybe you've got a qualification in functional training. So just have a think about the reason why you're here, because I'd like to make sure that if not by the end of this webinar, that certainly afterwards, I help you find some answers. Certainly if they're not within this webinar, then I'd like to support you afterwards as well. So what is it? Well, depending on where you read around what functional training is, an example from Gray Cook, who is an American strength and conditioning coach. He's also the founder of FMS, which is the Functional Movement Systems. And he also is very critical of his model in terms of its application and its objectivity. But he talks about everybody has a different definition of function. From our perspective, I guess what we're talking about here is the body is an integrated system, and each component provides collectively coordinated movements in active daily lives for us and our clients. Functional training, actually, its origins are in rehabilitation, getting somebody back from the wall, maybe with an amputation, for example, to get back to the ability to wash themselves, feed themselves, move around their house. It's filtered through into our industry, but because it helps us help our clients prepare their body for the task. It ingrains correct movement patterns so that our brains are familiar with those movements. So I've very carefully chosen a few images just to, I think this really represents the kind of things we see or think about in a functional training studio or a functional training gym. So what's your definition of functional training? We shall now look at and compare it to some of the world leaders. So if we take Mike Boyle. So Mike Boyle wrote a book, or several books rather, on advances in functional training, complete sports training, new functional training, and he was a strength and conditioning coach for the Boston Red Sox. So he describes it as an exercise continuum that involves balance and proprioception with the feet on the ground without machine assistance. I think that's a key thing that we think about these days in the gyms. Such that strength is displayed in unstable conditions and body weight is managed in all movement planes. Makes absolute sense. So let's look at Gambatta's definition, or Gambetta and Gray. Slightly more, the language here becomes a bit deeper. So multi-joint, multi-planar, proprioceptively enriched activity that involves both deceleration and acceleration, along with stabilization. Controlled amounts of instability and management of gravity, ground reaction, forces, and momentum. Okay. Kind of the so what question, right? It sounds like, yeah, okay, well, this all makes sense. It's the same. And then you've got Santana's definition, a spectrum of activities that condition the body consistent with its integrated movement and or use. So I'm imagining that whatever you were thinking of as your definition is something around where these three examples are coming from. These three strength and conditioning coaches, they're authors, they're very well known in the industry, certainly in strength and conditioning side of things and sport. And from an evidence-based background as well, or reputed to be. So another great image here, I think this one's been staged a little bit. If you look around at all their faces, I find that one quite amusing. I can imagine the cameraman saying, counting down, 1, 2, 3, and hold. But if we take the idea that our industry has gained, it's come from, or it's born from, if you like, bodybuilding. So if you think about traditional bodybuilding, 30, 40 years ago, Arnold Schwarzenegger, it's really where personal training was born, to gain a six-pack, large bicep peaks, delts, good quads, symmetry, sculpting of the body. is really what our industry is renowned for, rather than functional training. Functional training was really in rehabilitation. But our roles as trainers, coaches, even as therapists, it's changed dramatically over recent years based on the demands that our clients are asking of us. When you think about the lives we lead now, personal trainers, movement coaches, strength and conditioning coaches are being asked for a lot more than the original qualification was designed to serve. So this shift alters both the expectation of our employers, the clubs, the landscape of the industry, particularly us as individual sole traders running our businesses. How do we stay in the game, modern, up to date, safe and effective, when we get all these tricky clients coming through our door? How do we get them functioning well and fit for purpose when our role is evolving so quickly and so much, literally over the last particularly over the last 40 years, maybe even more so over the last year, right? So many experts believe that training tasks should actually be chosen in accordance with their mechanical specificity. So the relationship between the active daily life should be represented in their training in the gym, rather than simply trying to look good. So if you look at the names down at the bottom there, each of these are kind of saying the same thing. So it's about mechanical specificity to the task that the individual does throughout the day. So you can see where this is already highlighting a bit of an issue. So let's explore paradigm, because ultimately functional training is a paradigm. A paradigm, as defined by Kuhn, is a universally recognized scientific achievements that for a time provide model problems and solutions to a community of practitioners. So you've probably come across Kuhn at some point in your training. The idea with Kuhn's cycle, so Thomas Kuhn wrote The Structure of Scientific Revolutions, and he talked about the steps, which you can see on the image over on the right here. And understanding this concept and incorporating it into our approach can help to solve problems, and really it's understanding how the functional training paradigm fits into this. So pre-science is where there's no workable paradigm. Normal is a normal step where the field is scientifically based, and we understand that model works. Model drift is when the understanding starts to drift because there's an accumulation of anomalies or things where the model is unable to actually define or explain it. Crisis is when the model becomes broken because there's no longer a reliable guide within the model. The revolution is when a new model starts to emerge, and then we shift into a paradigm change. So if you imagine the paradigm over the last 30 years of bodybuilding through to functional training, there were fads, or depending on how long you've been in the industry. I know, Sharon, you've been around for a while. You have these trends. Our industry is kind of famous for its trends in nutrition, NLP for a while, strength and conditioning more recently, and now more so long-term conditions. And there kind of shifts in the paradigm of the industry and us as trainers and coaches and therapists as to what we need to do or understand, and how we then apply evidence-based practice. So a paradigm provides a conceptual framework, and that allows us to make sense of the chaos of trying to understand every single body that walks through your studio or your clinic. So I'm imagining now for a moment, if you were to think about all the clients you see, and each time a new one walks through the door, it's a whole brand new experience. They have different limb lengths, they've got different fat and muscle mass ratios, they've got different injury history, they might be different ages. And even if you are in a very niche market, maybe you work with pre and postnatal mums between a certain age bracket, each of those individual clients will still have a whole set of variables. And so we need some kind of conceptual framework to be able to work with them from a place that is informed, systematic, and allows us to support them in their movement quality. So a paradigm really stands for an entire constellation of beliefs, values, techniques that are shared by members of a community. So you and I and the industry, and I guess predominantly I'm talking to the exercise industry. But again, a paradigm shift is that we are crossing over with therapy, and also both the exercise world and the therapy world are starting to merge a little bit closer to the clinical world, because I see them as three separate industries. However, I'm quite confident that some of the people watching this will have both exercise and therapy skills, like myself, as an example. So if it's a community shared sort of belief and concept, then it can be challenging to change or shift that paradigm. So just have a think for a moment. Can you think of anything recently that maybe shifted a paradigm? Maybe not functional training, maybe functional training. So if you take me back to March 2020, I think it was the 21st, wasn't it? We all know that there was a huge paradigm shift that went into sort of overdrive when we were restricted in what we could do. And so all of those people, myself included, who were saying you cannot train clients online, we had our paradigm really shifted. So that might have been yourselves as well. Certainly, I hope you were able to work during lockdown, guys. And if you have clients, we felt, if you were like me anyway, I felt a duty of care. I had to change my paradigm of wanting to be with them face to face, literally just to help, because we didn't know how long we'd be locked down. They were starting to become, uncomfortable. They were losing movement quality, and they were coming to me. They trusted me. They wanted my advice. And that was a real challenge. How uncomfortable was that? Excuse the pun. When you think about that paradigm and how actually conceptually paradigms restrain innovation and progress. If you imagine a community of practitioners and people, and I think we've done a great job, by the way, over the last 18 months. But when you evaluate a paradigm like functional training, we instinctively look for ways to better deliver variations rather than, in the example of functional training, the challenge, rather than the challenge that confines because of it. So where functional training may seem to be, or we can do it in a different way, actually the whole concept of it could be something we need to challenge. This is also evident in a lot of the research, by the way. So not sure if you do read research, I encourage you to do that and use good resources like PubMed or Google Scholar to ensure that we are also coming from, even without degree level, we're generally a non-academic group. And so to be coming from evidence-based understanding is a really key aspect, which is what I'm trying to initiate for you today through this webinar. So let's just think again about the functional training paradigm in itself. And obviously, as I mentioned earlier, its history is from the clinical aspect of injuries. For us, getting those post-rehab or even pre-hab clients coming in, clients' issues are still persisting, even with functional training as a paradigm, allowing us a framework to design exercise programs from, because the body compensates. When you think about clients in pain, it may shift the way they move, or they may not have pain, but the way they move looks like a compensation. Have you ever had a client that you were just scratching your head over because no matter what you did, maybe their knees buckled in on a squat, for example, and so you started using bands around the knees, things like that, to hopefully improve the function of the glutes so that when they moved, when they lunged and walked and ran around fields or whatever it is they want to do, that the pelvis is more stable. And there's those clients where it just does not work. And you're thinking, well, why doesn't it? And so maybe we want to think slightly differently or challenge the functional training paradigm if it's actually not providing the solution. So let's explore this problem and why it's coming about. When we think about a good example could be a squat pattern. So I mentioned that a moment ago, and I had a million photos, and they were all generally with a massive bar on the back. So I was trying to be a little bit more generic, but I couldn't find somebody without a weight. So if you imagine a functional training paradigm, so certainly with Greg Cook's work in FMS, where we can use a squat as a benchmark or as a test for good movement. So one of the problems with that is the squat can look really, really good. So effectively, the client could pass that test with a high score. She looks great. She's even smiling. So she's feeling good as well. However, the body is fantastic at compensation. It's really good at helping us move, I want to say well, but maybe that's not the right word, aesthetically pleasingly. Is that a word? And so it can hide the fact that within her pelvis, maybe there is a small compensation occurring because she sits at a desk all day. So while the squat looks fantastic, she's got ankle dorsiflexion, knee flexion, hip flexion. The spine may well be flexed. I mean, it looks pretty upright to me, but I don't know what that lumbar spine is doing. So to appreciate that within a squat, there are several joints, and within those joints, several soft tissue structures, also your ligaments, your tendons, the muscles, the fascia, the nerves are in there as well, that could be almost hiding what's actually going on deep on the inside. So a functional movement as a pattern or as a visual demonstration or a test could simply be a visible demonstration of the body's amazing ability to compensate for its biomechanical flaws. And that can go in either direction. So if somebody looks like they're hyperextending, for example, and I found it really hard to find an image of a really bad squat. I mean, she looks amazing, but there's a little bit maybe of hyperextension, it could be argued there. But just if you imagine seeing somebody, I don't know, they're not upright, the butt's winking, so there's a problem. And that actually could be a deliberate thing where the body is visibly demonstrating how well the body's compensating to allow them to squat. So whether they look good or whether there's I'm putting it into quote brackets, a compensation that makes them look like they're not quite squatting well. How much do we worry about that or change that? We're trying to understand what every single part of the body is doing to influence the way our clients are squatting. And I have to confess, I just wanted to put this one in because I thought he looked so happy in his amazing squat. But I wonder what his pelvis assesses like. So the body's really good at cheating. So fundamentally, the body is really, really good at cheating. And that's what allows us to get away with some abnormal movement. Maybe that's the wrong word to use, some sort of discrepancy or aberrant gross movement away from great lines through the joints. We can get away with that because the body will cheat and compensate in the joints below and above and enable us to continue movement even when there's either an injury or an injury waiting to happen. So what's the question, do you think, that we need to ask? Is it really that we should primarily focus on the patterns of movement to prepare our clients for active daily living using multiple joint actions, squats, lunges, you know, these kind of well-known functional movements? You see all this interesting stuff on social media, particularly on Instagram, funky twisting lunges, and they look great, and you know, some of them actually feel great for me anyway. Whether that's the right thing to do on it is the big question. Or should we maybe start to look at each individual joint or structure on their own in isolation to understand how well that part of the body is contributing to those gross movements. So I hope that makes sense. So you can see on the image here, an example is she's lying the client down, so the client has no gravity, she's relaxed, completely passive. And what the biomechanics coach, as an example, could do here is use the back of the acromion at the end of the spine of the scapula, just to simply measure how high those scapula are sitting away from the bed. And this client actually looks pretty good, but I can't quite see her left shoulder there. If the measurement is asymmetrical, then because of the position the client is in, it's only going to be a limited number of things that are causing that measurement. Muscles or structures in the front of the chest that create the action of protraction would be the obvious consideration. So if the shoulders don't retract because the protractors are overactive, we can evaluate that lying the client down on the bed like this. If we got them into a squat, for example, and test the squat pattern, that might not pick this up. It might not see that actually one side of the front of the chest is compensating because this lady sits at a desk, uses her right arm on her mouse, and the right side of the shoulder is kind of almost adapted into a more protracted position long term than the left shoulder. And this over time has almost like a kinetic chain concertina effect down the body to begin to alter the way she's moving, and not in any way that's obvious or overly obvious straight away, but over time you're thinking, see how that knee's caving in on that side when she does that squat? I wonder why that is. And it could be something higher up the chain, is the point we're making here. So if we think about a new way, or this new way of thinking about the body, it kind of flips functional training on its head, temporarily at least. If we could assess the pelvis, understand the pelvis's ability to flex, extend, medially, laterally rotate, even the spine in the same actions that it's responsible for, the shoulders, also the knees and the feet, individually, in isolation, if we can break down each joint and structure's contribution to movement, surely when we ask a client to squat, we've got a big difference of what we're able to read. Isolating each area is going to give us more concept of which part of the body is causing the squat to look like it does, or is hidden by a really beautiful squat. So I hope that makes sense, just the two angles on that one. But I wanted to ask you, have you ever come across something called movement coding? Movement coding, and there are two kinds. So there was a guy called, I think he was a Czech neuroscientist or neurologist, I think. And I think he's passed away now. Carol Lewitt wrote a fabulous book called Manipulative Therapy, and he was way ahead of his time. And he talks about movement coding is that we are unique with genetic or unconditioned reflex codes, but then also conditioned reflex codes that determine movement that we gain as we live our lives. So if you imagine when you're born, you are given a certain genetic makeup, joint design, muscle attachments, some of us don't have certain muscles, others do. And then as we age and as we go through life and we go from childhood to teenage to adulthood, we put our bodies through a variety of movements on a regular basis, and maybe some movements not so regularly. We might gain injuries. We might have a certain job, maybe on a factory line, where we're always turning one way, or we play an asymmetrical sport, or we wear high heels a lot. And these are conditioned reflex codes. So it's trying to understand there are different sort of codings that our body presents with, if you like. So if we consider movement coding in terms of, we start with unconditioned codes, and during life we begin to acquire conditioned movement codes that compensate for injury or biomechanical flaws, as an example. That's quite a lot of coding to think about. Some of it we might be able to change, and others it might be more challenging. So let's bring that back to the concept and the difference, if you like, between our paradigms. So the current functional training paradigm in response to movement coding, it encourages us to accept that by patterning a movement correctly, we automatically ingrain the ability to perform the pattern instinctively, without taking into account the causes of the conditioned movement codes. Does that make sense? So the current paradigm, it's kind of given us the idea that we should do a pattern, do it correctly, and the idea is that's going to ingrain our ability to instinctively do that pattern again, but it actually doesn't take into account the conditioned movement codes of overuse, asymmetry, lifestyle, sport, or previous injury. If we bring in the new concept that I'm suggesting we might want to consider, it actually proposes to first identify and manage conditioned movement codes, i.e. adaptions, previous injury, idea, kind of rehab, if you like, or pre-rehab, post-rehab, whatever you want to call it, before we start trying to teach and prescribe the relevant functional movements, so that we can then improve that kind of conditioned movement coding in advance. Whereas the functional training paradigm doesn't do that. It kind of hides it and masks the idea that there may be compensations deep and intrinsic to our body. So again, what does that look like? Well, it might be that a logical progression is isolation work, preparation moves like muscle energy techniques, the concept of antagonist training, so that we start to rebalance the strength ratios. And a flow might be an example, like the images on the top line. We release the hips using a muscle energy technique. We then work the antagonist adductors, and then the following images then working the abductors. So you're balancing out the opposing muscles in a considered fashion. Same on the bottom line, going from extension muscle energy technique, flexion muscle energy technique, extension bridging, which is strength work, and then flexor dominant training again. So this is very untrendy. This is not fashionable in the functional training world. It's your kind of legs, bums, tums, if you like. So the Green Goddess and Mr. Motivator, if any of you are old enough to remember those days, the old aerobics sort of studio idea is actually, when applied systematically and logically, possibly not a bad idea if it starts to improve the conditioned movement codes that we've gained through our lifestyle. So here's another question for you then. Let's just challenge things further again. What is functional today? And you'll probably guess from the image there that actually functional movement and training is defined, ultimately, if we look back at those definitions we read earlier, by its ability to prepare people for their daily lives. So why then are we not hanging tiny little dumbbells off our fingers so that we can strengthen our typing muscles? I mean, that's obviously, that sounds ridiculous, but actually that challenges the definition, the pure definition of what functional movement is for. So think about that just for a moment. What we deem as functional training is to improve the movement we need for our daily lives, or our clients need for their daily lives. So that actually, it sounds ridiculous, but fundamentally it challenges the very origins of what functional training's purpose is. If we're not following the logic, we are not adhering to the definition of function as described by Boyle, by Vern-Gambetta, by Santana. So there you go. That's kind of the big challenging question, isn't it? Is, okay, so, okay, if we challenge that definition, if the definition is wrong, or maybe it's our approach, because functional training makes sense. So we kind of alluded to it throughout the webinar, is the concept of defining something, coming from an evidence-based background, looking at the origins of function and how our approach to functional training could be the thing we really want to look at. So let's start to pull this back together and see whether we can form some kind of conclusion based on what we've spoken about here. Because when you think about clients coming to us, they don't move in the way they did 30 years ago when our education was originally designed, coming out of the bodybuilding era into the gyms using isolation work to ultimately grow bigger pecs. And we challenged that paradigm because ultimately they were getting injured. So the health continuum that we want to kind of, if you like, have a scale of illness and wellness to get our clients to elite performance, and I'm using that language, I mean to be generalistic, you know, taking them from sedentary, if you like, through to moving well, through to moving really well over time. All our clients will be somewhere on that scale. And we need to find out where they are before we can prescribe their conditioning exercises. Most exercises, you know, they can be suitable for most people. The problem is that invariably they're prescribed at the wrong time. One example for you is, and again, Stuart McGill is another great world leader in biomechanics, particularly in terms of the spine biomechanics. Talks about core stability training can hurt some people and actually help others, is what McGill says. Because if they're not ready for it, actually what can happen is if QL is in spasm, if the sciatic nerve is tight, if the spine is stiff in certain areas, then doing core strength training upon that or challenging the trunk with functional training could actually make our client worse. Of course, we don't want that to happen. Lunges is another example. If somebody has a rotated pelvis, the example I gave you earlier with the my friend the skeleton there, where they've been sitting a lot and they've now got this functionally long leg, pelvis is rotated, the associated muscles of the hips become, they adapt into what's known as a subclinical span. So it's not painful, it's not a clinical issue, it's just an adaptive state, if you like. Then asymmetrical lunging is potentially going to cause a biomechanical issue at some point, certainly if it's done repetitively over any length of time. However, if they're functioning correctly around the pelvis, then the risk of a lunge hurting them is going to be reduced. So if we can understand specific joint biomechanics, so breaking the body down, like I showed you on the image, like when we spoke about my skelly earlier when I showed you on my real skelly. He's not real, I promise. He's a cast. If we can understand specific joint biomechanics of the pelvis, spine, shoulder, knees, and feet, and include the three subsystems, the myofascial, the skeletal, and the neural, our industry is not very good at testing the nervous system. We've kind of been made to feel fearful of that. And actually, you know, every time a client bends over and ties their shoe up, they're stretching their sciatic nerve. So we need to understand it better. We're not given those skills. The industry standard doesn't require us, not under any sort of insurance scope anyway. It's not compulsory to have the ability to assess these areas. And yet, how are we to help clients with their movement programs unless we do test them? If we test them, we can then identify the most efficient and relevant exercises to prepare their body. So we can take the concept of muscle energy techniques for a specific part of the body that's not functioning very well, like the piriformis, the glutes, or the hip extensors maybe, to improve the function of the hip extensors, to then understand how that relates to the antagonists. It gives us a systematic approach to, okay, in isolation, start our client moving better to eventually get them towards their functional training program, which is obviously where we want to end up getting them. This also means that functional training's got a greater chance for success, not to mention it's going to reduce the risk of injury. Clients are almost accepting pain and injury as the norm these days. That in itself is frightening. So we need to change something. The industry is beginning to find that there are now level 4s in long-term conditions. We've had a little bit of FMS come over from the States. We've got mental health, we've got obesity, but neuromusculoskeletal testing is not within our remit, or it's not being given to us as part of our remit, and yet we do need that skill. Of course, what we don't want to be doing is diagnosing or attempting to diagnose. All we want to do is assess quality of movement in our clients. If we can do that, then this new paradigm of isolation, then integration, would make sense. We're using the concept of rehabilitation on people who are not necessarily injured. Maybe they just don't move very well, they've got a little bit of backache or a niggly knee. If we can isolate body parts, we can work away from the area that hurts, at the same time as continuing to work with a client until the point at which we feel it's appropriate to move them into functional movements. We can also then work alongside our clinical allies or our clinician buddies, hopefully, while they work on the area that's uncomfortable, if that's appropriate. But I think we're all very nervous working with clients in pain or with any history of recurring injuries, and yet this would solve that solution. So by understanding how we can improve the pelvis and spine function, identify muscle spasm, test joint mobility, test the nerve mobility in isolation, that gives their body the capacity to move. It prepares them ready for our core stability program or our trunk strength training, whatever you want to call it, that then allows the body to be stable and in control. So that when we do our functional piece or our global muscle performance moves, we integrate moves together, the client is prepared. They have robust connective tissue, nerve mobility, mobile joints, but also stiffened or muscles that will stiffen appropriately to control movement at the same time. So the presentation that I've brought to you today, just before I get into the Q&A, there's some references in here, and I'm happy to send these on to you with a PDF of the slides. But just for your information, we do have a Facebook group where we discuss all things biomechanical. It's on Facebook. It's called the Biomechanics Q&A group, so that this conversation can continue there. You can email me, rachel@biomechanicseducation.com, at any time. And for those of you who are interested in maybe experiencing our classrooms, I will give you your money back from this workshop by discounting £25 off any of our face-to-face workshops.